when we have the kind of the late breaking abstracts or the new research that's been presented, as I look at some of the stuff that we evaluated earlier to try and include in the content, really eye-opening and interesting ideas. Again, not just on the device side, not just
Right.
on the technique side, but medical therapy, new aspects of wound care, and that kind of speaks to the heterogeneity that's out there in this field. We don't know exactly the best way, or if there is one best way to take care of these patients in terms of putting everything together from diagnosis to pre-procedural management to the actual procedure to things like nutritional
Right.
aspects afterwards in the wound care and optimizing medical therapy.